Hi, I'm Todd Lanman. I'm a Beverly Hills spinal surgeon, been practicing here for 30 years. And I've recently gotten licensed in the state of Florida, and we're going to be centering our practice, my partner and I, in the Miami, Tampa, Sarasota area. And we'll be coming out there and doing some telemedicine consultations here from Los Angeles and coming out there and performing some surgeries. We have a very large contingent of patients from the East Coast, and so we felt that this would help accommodate them from having to travel here so much to recover. I focus predominantly on artificial disc replacement surgery. I believe that is the future of all spinal care for the most part. Some people have to have fusions, but I try to avoid fusions because I don't want to limit your mobility and motion. So to keep you functional, active, moving, we do artificial disc replacements in the neck. We do artificial disc replacements in the low back as well. Multi-level. FDA has approved 1 or 2 in the lumbar and 1 or 2 discs in the cervical. But we can do off-label uses, which is 3 levels, sometimes 4 levels. In fact, I've done a few 5 levels. I myself have 4 artificial discs implanted in me. All 5 of my discs have been replaced in my low back. So we're looking forward to seeing you in our Florida offices, and we'll talk soon.